Hello, you're on the Men's Health Club YouTube channel. Today we'll discuss a complex male problem such as early ejaculation. And again, a well-known urologist, a specialist in male sexual and reproductive health, doctor of medical science and philosophy, Professor Nika Akhvlediani kindly agrees to help us today. Hello, Professor.
Hello.
And we will start with the question, what is early ejaculation?
Today we have 4 diagnostic criteria of early ejaculation. First one is the time of sexual intercourse. It should be less than 1 minute if we talk about lifelong early ejaculation, and less than 3 minutes if we talk about acquired premature ejaculation. Second criteria is inability of control of ejaculation. Third criteria is unsatisfied sexual partner. And fourth diagnostic criteria is interpersonal difficulty in sexual couple, which can be cause of conflicts.
How common is this disease, and is there a difference in frequency of this disease in many different countries?
I have to say that early ejaculation is most frequent sexual difficulty for male. Approximately 30% of males have this disease. We have some differences in countries, but I think most frequent early ejaculation is in Asia.
Does the frequency of early ejaculation depend on age?
We can't find any relationship with early ejaculation and age.
What forms of early ejaculation are known today?
Today we know 2 general forms of early ejaculation. First one is lifelong premature ejaculation from the start of sexual life, and second form is acquired premature or early ejaculation.
What are the causes of primary and secondary early ejaculation?
Today we know 3 general reasons of primary or lifelong early ejaculation. First one is dysregulation of serotonin. You can find sufficiency of serotonin in brain cells. Second one is hypersensitivity of pineal glands. And third one is short pineal frenulum. If we talk about reasons of secondary or acquired early ejaculation, we know 3 general reasons. This is 3 diseases: erectile dysfunction, chronic prostatitis, and hyperfunction of thyroid glands.
Professor, are there any psychogenic forms of early ejaculation?
I think yes, but today we don't have any evidence for this idea.
How to diagnose a primary early ejaculation?
Today we have some questionnaires to find this disease. I mean early ejaculation, primary and secondary as well. We should use it. Second method is measurement of sexual intercourse time, duration of sexual intercourse. Moreover, we can use lidocaine test. This is a very interesting test when we use anesthetics, usually lidocaine, topically on pineal glands, and we measure the time of sexual intercourse under anesthesia. And if we have biotensiometry, we can use it. It's apparatus for measurement of pineal gland sensitivity.
What diagnostic strategy should be used in secondary form of early ejaculation?
To verification of acquired early ejaculation, we should have evidence of acquired character of these disturbance, according from anamnesis, history of the disease. If acquired ejaculation depends from disease, we should find this disease. I mean, erectile dysfunction, usually we use for this questionnaire. Chronic prostatitis, very easy to diagnose. If we use 2-glass urine test, we should collect urine before and after of massage of prostate. And hyperthyroidosis is very easy to diagnose if we use hormonal test of the blood.
What is the treatment for primary early ejaculation in case of dysregulation of serotonin in the brain?
If the reason of this disease is insufficiency of serotonin in the brain cells, we should use medication to elevate the concentration of this mediator in the brain. Today we have special medication, pills. The name of these pills is dapagliflozin. Usually we use 30 or 60 milligrams. We should take this medication 1 hour before sexual intercourse. It's very effective treatment, but we have some adverse effects. It can be cause of discontinuation of the treatment.
How to treat primary early ejaculation associated with hypersensitivity of the penis?
In this case, we should decrease hypersensitivity of penile glands. Today we have 3 methods for these. First one is lidocaine. We can use it topically on the penile glands. Second method is implantation of hyaluronic acid under the skin of penile glands. And third and most effective method is surgical technique. I mean, selective penile neurotomy.
How to treat primary early ejaculation when it's associated with short penile frenulum?
If we find short penile frenulum, we should use surgery. I mean, frenuloplasty. If we have virgin case, usually we use very easy technique to transverse incision of the penile frenulum. And if we have scarred tissue in frenular zone, usually we use Z frenuloplasty.
How can we treat a secondary form of early ejaculation?
These cases we should treat main reason of early ejaculation. I mean, we should treat erectile dysfunction, chronic prostatitis, and our colleagues, endocrinologists, should treat hyperfunction of thyroid glands.
Are early ejaculation and male infertility related?
Yes, because early ejaculation correlates with decrease of quality of the sperm. We have some evidence of this.
Are there any ways to prevent early ejaculation?
Unfortunately, we can't prevent primary or lifelong early ejaculation. But we can do that if we talk about secondary or acquired early ejaculation, if we find and treat causative disease in timely manner.
In our conversation, you touched such a problem as erectile dysfunction. Could you tell us about it more?
I promise that we definitely talk about this medical problem next our meeting.
Till our next meeting.
See you. Bye.